Thanks for watching your ED Explained, expert advice on treating erectile dysfunction series. I'm Dr. Robert Valenzuela. I'm a urologist at Mount Sinai, Washington Heights Urology in New York. I specialize in men's health, including erectile dysfunction. I'm here to talk about erectile dysfunction and erectile dysfunction treatment options. As you know, the definition of erectile dysfunction is the inability of obtaining and maintaining an erection sufficient for penetration, or to have a good erectile function in order to be able to have intercourse. Is erectile dysfunction common? Yes, it is a lot more common than what we like to see. Erectile dysfunction affects over 40% of men by the age of 40. Erectile dysfunction affects at least 30 million men in the United States. So what causes erectile dysfunction? Although ED is common, it is not an inevitable part of aging. And in most cases, it can be overcome. In 80% of cases, ED is caused by a physical problem. Did you know that patients with cardiovascular disease, hypertension, diabetes, prostate cancer, or any cancer that affects the lower genitourinary tract or the pelvis can cause erectile dysfunction? And one of these causes is also psychological. Some of the causes of erectile dysfunction may be just due to stress or psychiatric conditions. The mental health effects of erectile dysfunction, or ED, in 50% of the patients, they say that it impacts their everyday life, results in lower self-confidence, less frequent sex, and it impacts their ability to have an intimate relationship with their partners. That means that they're preoccupied with their inability to maintain an erection, their inability to perform in the bedroom. This is very difficult for patients. So how does an erection occur? In order for you to get an erection, the first thing that happens is you have to have some level of stimulation. We all know that men get what's called a nocturnal erection. The nocturnal erection, these are erections that happen during the nighttime. They're independent of sexual activity, and these erections may be completely normal, but in the bedroom, they may not be able to perform. So in order to get a sexually stimulated erectile function, you need to have some sexual stimulation. Then what happens is blood flows into the penis, it gets trapped within the penis, and then that causes you to get a firm erection. What we call a compartment syndrome, where the blood is trapped within the penis and you're able to maintain that erection until you have resolution. What is resolution? Usually it's going to be due to an orgasm, after an orgasm, or in patients who have erectile dysfunction, they may lose their erection prior to climax or an orgasm. So now that we know how an erection occurs, well, let's talk about what happens when you have erectile dysfunction. Oftentimes, these patients are able to get an erection or a partial erection, but they're not sufficiently hard in order to be able to have intercourse. And this happens because blood flows into the penis just like in a normal state, but you may have what's called a venous leak, or the tissues don't support the blood flow to be able to maintain it within the penis. And so the patient may lose their erection prior to engaging in sexual activity. And again, this may be caused by comorbidities such as the ones that we mentioned. So I think at this point we can talk about what are the treatment options for erectile dysfunction. You know, since 1998, we were blessed with a medication. I say blessed because prior to that, we had nothing to offer our patients. So yes, we have oral medications. As we all know, these are very good, but they don't work on everybody. This isn't the cure-all for everyone. We have medications that can be inserted into the urethra. That's the urinary channel that can help you obtain an erection. There are other things that we can use, such as a vacuum erectile device. This is something you put over your penis in order to get an erection and maintain it. And then there's shot therapy. Now, not a lot of guys want to do this. They have to give themselves a shot in the penis in order to be able to get an erection. And these medications can be very, very effective, but you lose one major component, which is spontaneity. Another treatment option is the surgical restoration of erectile dysfunction. What does that mean? It's the use of a penile implant. Now, penile implant sounds like you're putting something outside the body. No, this is a surgical procedure where you insert a penile implant into the body, and think of it as a breast implant. When women get breast implant, nothing really shows. Everything is inside. Same thing with a penile implant. It looks completely natural, but it is on demand. That means that you're able to pump it up, you're able to get an erection, and you're able to maintain that erection for as long as you need to or for as long as you want. The benefits of this treatment is that, you have the spontaneity. You're able to have sex. It's like restoring your erectile function back to what you were before. So like with any other kind of therapy, surgical complications associated with penile implants can include infection, bleeding, pain. These are the immediate complications. Long-term, you can have malfunction of the prosthesis. And you also have to keep in mind that this is an irreversible procedure, that you are dependent on the penile implant in order to obtain and maintain an erection. To learn more, you can visit coloplastmenshealth.com.